So, from our perspective, it will bring some major changes if a lot of it is implemented. I mean, it's been over 2 decades in the making now to really bring some of these changes. And some of the big aspects are always about equal access across Europe, which is what we wanted to bring. But with that comes, some of the aspects could change that could actually change the way that Europe is actually perceived from an investment perspective and from an R&D perspective. Because a big part is looking at the whole data protection, which could be shortened. Now, if you're looking at what's happening in China and the US, is there you've seen a huge divide in terms of how much is being invested there versus Europe. So that's one of the concerns. We should look for areas that will actually increase investment into Europe and thus increase access to more patients in Europe versus aspects that will actually distract from that. So I think it really goes without saying that prevention is better than cure, and to invest early up front into patients' healthcare is the most cost-effective way to have a long-term impact. And specifically how MSD looks at it is that recently the whole HPV campaign was launched where we are really looking at vaccinating children. We've seen it really take off in the last just under a year, and we've seen Prime Minister Donald Tusk as well as Minister Leshina talking about it. But this is where we really need a lot more focus, because currently the vaccine rate is just around 20%, and the goal is to get to about 60%. But we know to eradicate the disease, you need 90% plus. So we need a lot of education here. We need to look at potentially increasing the cohort size. We need to look at maybe, introducing it at school level, because this all will help increase the vaccine coverage rate, because we know in the long term what a huge impact this can have on women's lives. And some of the statistics are even showing us that 50% of the women that are impacted this are still women that are able to have a proactive life and have, and add a lot to society. And actually 30% of them are actually dying from cervical cancer. And this is where we see one of the big issues, because if you're not preventing cervical cancer, this is where you're going to have a long-term impact. And if we look at it from statistics perspective, just over 12 women out of 100,000 are impacted in Poland. And Poland stands out here because it's basically double what we see in other countries, like in Spain and China. And this is where we need to have a lot of focus on. So if you're looking at what we see globally, one of the biggest impacts is in Australia. Their plan is to eradicate the disease, and they are well on track. They've been, for the last 10 years plus, been vaccinating again, so they will see the impact. And why we say this from a prevention perspective is that it's an investment early on that prevents a lot of problems later in life. And this is where we see one of the countries that's taken this. We've seen multiple countries rolling out these over the last few years. Poland is not the last, but it has only been rolling out for just over the last 6 months. So I think it's like I've said, prevention, but on top of that goes around education. So educating the population on why the need to vaccinate, the need to have this early intervention, to invest early, to be able to do this later. Yes, we do have novel, like you said, novel drugs that, come in the treatment form for later lives in cervical cancer and endometrial cancer. And there's multiple other cancers that we have treatments in melanoma and lung. But this is really at the end stage versus if we can get in there a lot earlier. And I think just in the last, I think it's in 2022 already, we had about 1.4 million vaccines across a host of different viruses that have been used in Poland. So this is something that is incredibly important to me, and it's actually taken a really great direction in the last year. Is that in Poland specifically, we've partnered with the National Institute of Oncology, along with the Medical University of Warsaw. And what is important is that there we can see what impact we are having in the real world setting. So where we actually have invested, where we've seen over time, but now having a look at the data to say what impact and where should we focus on the one hand, and on the other hand is to say where is Poland focusing and where should they have more focus in terms of how we access patients. So by having these public-private partnerships and having access to data outside of just the clinical trial setting is where we can actually see what impact countries are having and how we can further work with countries. And this is where we really want to focus and continue doing that, and have, is to have this wealth of data to make sure that we are working with countries and making sure their healthcare and their health outcomes are both improved in the time to come. So yes, it has been my first real winter with real snow, which was, it was lovely. It was beautiful. It was almost majestical. And I also see that as the stage where Poland is right now, with all the decisions that Poland has made, going forward with healthcare and making some massive improvements. Now that means, Poland for us as a company is also incredibly important. There is no, the investment we've done in clinical trials, just to name, some of the numbers, is that it's been over 150 million PLN per year. We're still waiting for some more data, but there's over 4,000 patients on clinical trials. So there's over 150 trials running. So it has a huge significance for us as a company and us as a country. And we can also see moving forward, some key and critical decisions have made, and it's on a great trajectory. It's now how do we focus more here on making sure that more patients get access to these novel medicines. So there really are a multitude of learnings, and if you look at the discrepancies in South Africa in terms of what is private and what is public access, there really is a few in South Africa that get the same type of access as you would get in Poland. So how do you increase, because if you look at the number of people and patients' lives, South Africa is quite a much bigger population, but Poland itself is a big population. And therefore, how do you make sure that the multitudes of patients get access? So South Africa could learn a lot there. I think more from what Poland could learn from South Africa is this partnership with pharmaceutical companies and having this access to data. There, the private funds sit on a lot of data that they use in a very, I would say, in a very productive manner to make sure that health outcomes are tracked and that you can learn from the past and improve on that. And that's something that Poland could really focus on.
Okay, thank you.
Thank you very much.